to have her here. So, and I also have Madeline. She's one of our caseworkers and interns here at Daughters of Both Sons. And, we're very excited to have this conversation. Um, so let's get started. So, as you guys see and know by signing up, the conversation today is closing the gap from pregnancy to possibility. And we will be speaking about advancing maternal health equity for Black and Latina mothers. And as I stated at the beginning of this conversation, this is a very important conversation to have. It doesn't get speak on about until we see a situation that rises up and occurs that ends in a tragedy. And this is why we need to keep advocating for these topics specifically in these sectors, right? So I do want to, again, as I stated, my name is Jessica Sanchez. I'm the founder, CEO of Daughters of Both Sons. We work on trauma informed care, and we believe in culturally responsive care for Black and Latino women as well. We work across the US. We have conversations like these. We try to have them monthly with different topics so we can bring more education and advocacy work around these conversations as well. I also have Madeline here. She's one of our MSW interns and caseworkers here, Daughters of Both Sons. She's passionate about this topic as well, and she's going to be bringing some insights. And we have a featured guest here, Molly Perez. So she is a licensed clinical or licensed mental health social worker from Strong Beginnings. And Molly, because I do love when folks can have that agency to just represent themselves. Tell us a little bit about you and your experience in terms of what you do in the field.
Sure. Again, my name is Molly Perez. Good evening, everyone. I am a licensed master's level social worker clinical, and I have been a social worker for over 20 years. And so, what I have been doing for the past 5 years is working specifically to address health disparities among Black and Brown women when it comes to pregnancy and infant health. And so I'll leave it at that so that I don't give away my whole presentation in my introduction.
Thank you. Um, so thank you for that short introduction. Just wanted to give you guys a little overview on who we are and what we're bringing to the table today. So we want to start on why this conversation matters foremost, right? So every mother deserves to survive pregnancy and thrive afterwards. So, despite medical advances, we do tend to see that Black and Latino mothers, especially women of color, right, brown people as well, and brown women, continue to experience preventable barriers that can impact maternal and infant outcomes. So before we dive into all of this data, I want to start with why this conversation is important. Obviously, we do know that this is a topic that we do know that this does exist, but there's more educational and advocacy work that can go into informing folks the importance of these disparities in our communities, right? And today we're going to explore where those barriers exist overall, why they happen, and what we can do collectively as a whole to bring that advocacy, that education, and improve maternal health incomes for Black and Brown women in the community. So during this conversation, this workshop that we will be having, you'll be able to understand maternal health disparities, identify systemic barriers to care as well, explore continuity of care as well, learn community based solutions, and also be able to strengthen collaboration across the sector, right? And we also especially want to explore that the continuity of care, right, throughout pregnancy and postpartum care, and learn on community-based solutions to these issues that we are seeing in the field as well, and just be able to improve overall outcomes as well. So I am going to leave this up to I believe Madeline, and she will
Mhm.
take it over from here.
Okay, so for this slide, we're talking about how maternal health is truly a public health issue. One statistic that often surprises people is that more than 80% of pregnancy-related deaths in the US are considered preventable. Black women are approximately 3 times more likely to die from pregnancy-related causes than white women. These disparities persist even after accounting for factors like income and education. Another important point is that over half of pregnancy-related deaths occurred during the postpartum period, highlighting that our responsibility to mothers doesn't end after delivery. And follow-up care and ongoing support are absolutely essential. Addressing these disparities requires a multifaceted approach that includes improving access to comprehensive care, fostering culturally competent healthcare practices, and advocating for policy changes that prioritize maternal health equity. Community-based initiatives can play a crucial role in bridging gaps, offering support, and empowering mothers through education and resources. By actively listening to and valuing the voices of mothers, especially those from marginalized communities, we can better understand their needs and work collaboratively to create solutions that ensure every mother not only survives but thrives. Through sustained efforts and genuine commitment, we can move towards a future where all families receive the care and respect they deserve throughout their entire maternal journey. And then we're going to go to the next slide. Okay. When we talk about maternal health equity, we're talking about much more than simply having access to a hospital. True equity means every mother has access to timely, high-quality care and is treated with respect, feels safe, receives emotional and community support, and has someone advocating for her when navigating healthcare systems. It's about creating conditions where every mother has the opportunity for a healthy pregnancy, birth, and postpartum experience, regardless of race, ethnicity, income, or background. Achieving this requires addressing the root causes of disparities, such as systemic racism and implicit bias in healthcare settings. We must also invest in community-driven initiatives that empower local organizations to provide culturally competent care and resources. By fostering partnerships between healthcare providers and community leaders and policymakers, we can develop strategies that prioritize the voices and needs of those most affected. Education and training for healthcare professionals on the unique challenges faced by diverse communities will play a crucial role in transforming the landscape of maternal health. Ultimately, it's about building a healthcare system that not only responds to medical needs, but also understands and supports the social and emotional and economic factors that contribute to a mother's overall well-being. Only then can we ensure that all mothers, regardless of their circumstances, have the support and resources they need to thrive. And then go to the next slide. So pregnancy isn't just one event. It's a journey that includes prenatal care, labor and delivery, postpartum care, and long-term wellness. Unfortunately, families can fall through the cracks at every stage. Some may delay prenatal care because of transportation or insurance issues. Others may miss appointments because of work schedules or childcare responsibilities. Many mothers lose consistent follow-up after giving birth, especially when mental health needs go unrecognized. Right now, I'd like everyone to think about this question. Where do you see the greatest breakdowns in your care within your organization or community? Please consider how these breakdowns might be addressed through community action, policy changes, or innovative healthcare practices. Are there existing programs that could be expanded or new models that could be developed to bridge these gaps? Furthermore, think about the role that collaboration plays in improving maternal health outcomes. How can healthcare providers, community organizations, and policymakers work together more effectively to ensure that every mother receives the care that she needs during her pregnancy journey?
And I wanted to add to that also, Madeline,
Mhm.
because I'm thinking about that question as well. And Molly, maybe you can add some insights in my community because I live in South Carolina, but I like to consider this like a semi-rural area. I think what we lack, at least in my area, everyone lacks different barriers, but specifically what I'm seeing, especially throughout the US, is culturally competent care. That does make a difference, right? And Molly, correct me also if I'm wrong, if you're seeing the same things. As I'm speaking to clients on a daily basis, not only dealing with their mental health, but also with their physical health, right? When it comes to their primary care, OBGYN care, um, culturally competent care is extremely important because when you have someone that has that worldview, right, and that understanding of what it is to be a woman of color and having these disparities in the mental health or even the health system, right, it does make a difference because they could look at it through your lens. So I just wanted to also just see what you thought about that as well, Molly.
Yes, I would agree with that. And it just made me think of one of the simplest examples that come to my mind is a situation where a woman of color gave birth at the hospital. And after she gave birth, she kept tapping her head. And she would periodically, when the nurses and the caregiver, the medical professionals would come in, they'd see her tapping her head. And they wrote in her chart how they were concerned about this. They saw it as, essentially some form of self harm and thought maybe
Mm.
she needed some mental health support. However, those of us in the Black community know what is a woman doing when she's usually tapping her head, a woman of color, when she's tapping her head. What's she actually
She's
doing?
she's itching.
Okay.
She's
Yes,
itching.
her
She's
hair
scratching.
is itching. Exactly. And instead of messing up her hair, she's just
Right.
tapping it to relieve the itch.
Mm.
And so something as simple as that, was completely misunderstood. And that's just a really, minor example, quite frankly, of how cultural misunderstandings impact care.
And I was actually speaking to a client today that lives in Alabama. But when I'm telling you, this client came to me, right? It was in crisis mode, but she was crying because she was telling me the lack of culturally responsive care and how her needs, even when it came to her physical health, were being diminished, not just her mental health. So it's almost like having someone walk into an office and treating them as another number, another body, another patient walking in, but not really taking into account their whole medical history. And she told me, look, I feel like I'm going crazy because I'm jumping from doctor to doctor. They're not hearing me, they're not understanding me. I know my body, and I feel like I'm not being taken serious seriously. Like, I'm not being helped. I'm just being diminished and undermined. So this is for me because I've gone through it myself. Like, I've literally, when I'm telling you that I've had to check my doctors on drug interactions, even there, because they didn't do the work to even check on medications that I was taking that interacted with other medications, to an extreme point where a doctor that what Caucasian was telling me was diminishing my symptoms of an ear infection. Came to find out, I went back to the hospital the next day because I knew this was something more. There was no way. And a doctor that was Latino did a CT scan and found that I had an infection on my mastoid bone that he told me, if you didn't come in, that would have went to your brain and you would have been dead. So these are things that I'm like, okay, from experience, it's made me advocate for myself. And I'm all for advocating for, if you don't advocate for yourself, who else will? But it is sad that even in this field, when we're talking about whether it's mental health or even your physical health, how we're not being taken serious when we have certain symptoms and we're undermined, right? And this comes from stigmas and biases, to be completely honest. So, but yeah, so we'll keep going. It was just a discussion that I just wanted to delve into because I've seen it from lived experience, and I know various other people and clients that go through this on a daily basis. And probably most of you have too in the past as well. So I'll let Madeline take the floor and continue.
Yeah, so we know that health outcomes are shaped by much more than medical care alone. Factors like stable housing, reliable transportation, insurance coverage, food security, employment, and language access all influence whether someone can receive consistent care. For example, a mother may have an excellent physician, but if she can't get transportation to an appointment or can't take unpaid time off of work, those barriers still impact her health. That's why addressing social determinants is such an important part of mental health equity. By creating a supportive environment that addresses these determinants, we can begin to close the gaps in maternal health care. This means implementing policies that provide comprehensive prenatal and postpartum support, ensuring access to affordable and reliable transportation, and advocating for paid family leave. Additionally, fostering partnerships with community organizations can help bridge the gap between healthcare providers and the resources families need to thrive. Education and outreach efforts are equally critical. Empowering mothers with information about their rights and available resources can help them make informed decisions about their care. Healthcare providers can also benefit from training that increases awareness of implicit biases and promotes culturally competent care. Ultimately, the path to maternal health equity requires a holistic approach that considers the whole person, their environment, and their unique needs. By working together, we can create systems that are not only responsive, but also resilient, ensuring that every mother has the opportunity to experience a healthy pregnancy and beyond. So, it's easy to assume health outcomes are based solely on personal choices, but the reality is much more complex. Structural racism, implicit bias within healthcare, shortages of providers, fragmented systems, economic instability, and limited culturally responsive services all contribute to these disparities. Another discussion question I would like to ask is, if maternal deaths are preventable, what do you believe is getting in the way? The goal isn't to place blame on individuals, but to recognize that improving systems creates better outcomes for everyone. We need to look at the broader picture and consider how systemic issues can be addressed to close these gaps. For instance, ensuring that healthcare providers receive training on cultural competence and implicit bias can help create a more inclusive and supportive environment for all patients. Additionally, increasing funding for healthcare infrastructure in underserved areas can make a significant difference in access to care. Moreover, fostering partnerships between healthcare systems and community organizations can enhance resource connectivity and provide more holistic support to families. By advocating for policy changes that promote equity and access, we can work towards a healthcare system where every mother receives the care and support she needs throughout her maternal journey. Engaging in community-based initiatives such as the community health worker model can also empower individuals by leveraging shared experiences and building trust. Through collaboration and innovation, we can create a more equitable healthcare landscape that supports the health and well-being of mothers and their families.
And this is on the 13th, right?
This,
On this one.
let's see.
This is on the 10th. So this is the maternal care journey. Um, so when we're looking into the maternal care journey, right, and Madeline, me and you can feed off this as well.
Mhm.
When we look right from prenatal care, labor and delivery, then postpartum care, because that's something that it's not just while you're dealing with the pregnancy and labor and delivery, but also when we're talking about the effects of postpartum anxiety, postpartum depression that affect mental health for women as well. And then community support systems, excuse me, and support. One of my favorite quotes that I like to say is that I don't believe in broken people, I believe in broken systems. And I think this is where we see these gaps in well within systemic barriers, right? In our communities for lack of. And sometimes it might not be sometimes lack of in certain cases. It's also that the systems have to be restructured, right? And I see this a lot. And this includes, like we're seeing here, missed referrals, loss of insurance coverage as well, which that's something that we're dealing right now in America, with subsidies being cut from the ACA and cuts that we're seeing overall across, the US and health premiums going up. This affects the care that most folks can get. And another issue that is seen as well is folks that are right there at that threshold where they're not eligible for Medicaid because they're barely above that threshold, but they can't afford a premium of $500, $600, right? So at that point, what are they able to do to get those resources if they can't even get government assistance because they're just at that threshold also versus, well, they can't afford an ACA plan, or in some cases, some people can't even afford employee benefit medical plans that come out of their paychecks. Even 100 and something dollars makes a difference, right? And sustainability and a person's ability, like availability and ability to pay bills and things of that sort. And then when we look in rural areas, there's also lacks the means of transportation for most folks. And I think this is where, at least for certain services, and I see this more in the mental health sector, and it is expanding, don't get me wrong, and physical help and primary care appointments. But obviously, when we're talking about going to an OBGYN, this is care that you need in person. This all can't be done online. So it's good, especially after COVID, that we've expanded resources to have telehealth and virtual visits online. So that's a step that has helped us move forward, but also the lack of, there still needs to be transportation in order for certain folks to get to their appointments. I know some insurances that do offer that, right, as a benefit, even through Medicaid and Medicare. But even then, right, let's just say, like we were just talking about, the threshold of people mm, right there that they can't afford an ACA plan because it's too high, yet they can't go on Medicaid and they're living paycheck to paycheck as well. Let's just think about that in that aspect as well. And if they don't have their own transportation, how can they access, especially in rural areas, transportation to appointments? So these are things that we need to think about, especially in lack of care coordination, folks being missed within the gaps as well. There's many people that get lost in the gaps and being referred to specialists, being referred to, another agency, depending on if something else is going on, because we do see that nowadays primary care has taken a forefront in checking depression and anxiety symptoms as well. So, for most folks, when you go to your doctor's appointments, they also want to check, even throughout pregnancy, right? The scale of your GAD7 and your PHQ-9. So, that's your anxiety assessment and your depression assessment to see where you're landing, right? And if those are things that they cannot take care in house, they refer you. But like I tell folks, and this is just, a conversation I have, and I've seen this working as well in the healthcare system, that many people get lost in the gaps because of the organizational structure of certain practices as well. So that's another topic for another day, but these are systems overall that need to be fixed, right? Because that can bring lack of care. And then, as we were talking about, too, mental health services barriers. Thankfully, we can jump in into virtual care now, right? Whereas before it was more limited, so that expands that service and gap. But many organizations and agencies that I've talked to are limited on support. They don't have enough hands on staff, which means they're burned out, which we have to take also those things into consideration. And then also, let's just say for government funded agencies, not enough funding is going into these agencies, or even into, let's just say, nonprofits, right? In our nonprofit, we tend to coordinate, and Madeline can speak to this, coordinate care and resources. And we have a white hand glove type of service where we want to help and do help folks from the beginning to the end. And if they don't find the resource, then we keep on researching. And that's something that I push for all of our caseworkers here and MSW students, of us pushing until we can find the resources. And a lot of that takes advocating for the patient. Because even myself, I've had to jump in the past working in healthcare, claims and authorizations, and almost tackle and fight with practices to help patients get the care that they need, because they're being lost in the gaps within the system because the systems are not organized the way they should be. So, and that limits the follow up support as well. So, we really need to look into overall the systems that we have in place, even as a society, especially in this country, and how can we better those systems overall, right? When it comes to mental health and also your physical health, because everything's intercorrelated and intercombined, right? So, um, as it says here, right, every transition in care is a potential point of vulnerability. That's 100% true, right? and especially a woman that's going through prenatal and postnatal care, right? And how we handle that. So, Madeline, I'm just interested also to just conversationally know your thoughts on this as well, because I know you're passionate, right, about this
Mhm.
topic. Um, but what do you think, just knowing the information that you know regarding this topic, that you would think in your eyes or your point of view and your worldview, the gaps that you see continuously in this, or like in this arena that we're talking about on maternal care?
For me, the biggest gaps that I've seen, just like even in my past role as a care coordinator, it's either lack of providers that deal with clients who some clients don't have insurance. And so even when I would be working with a client and then they would lose their insurance and then I would have to tell them that I can't work with them anymore. And so I would have to they would have to lose out on help pretty much just because they didn't have insurance, um, which was really challenging. And then transportation issues, yes, I agree with that one because sometimes clients they don't know public transit. Sometimes they don't have access to public transit. Um, and so helping them set up public transportation, I believe that's one of the struggles as well. And then just from speaking from personal experience, like after that 6 week appointment, mothers are pretty much, thrown to fend for themselves. So I wish
Yeah.
that the postpartum period would be extended a little bit more than 6 weeks because it's definitely longer than 6 weeks.
100% agree. And we see that in other countries. In
Mhm.
other countries, they have fabulous, like when it comes to maternity benefits, even paternal benefits, right?
Mhm.
And it all here, even though like the basic, right, or the cutoff, like the minimum is 6 weeks. It
Mhm.
depends on the company you also work for. For
Right.
example, I worked for a company based out of California at one point, remote, but they were gracious to give me 4 months, 16 weeks paid
Mhm.
maternity leave, and that was paid, right? And a
Right.
lot of people don't get that here in the US, right?
Mhm.
So it does go with also the company's core values as
Mhm.
well. But overall, the standard is 6 weeks in America. So these are things that even policy wise that we have to look at overall in the United States on where can we better policy changes so we can better support our mothers, our communities, because at the end of the day, I could see this from various aspects in terms of the reliability even of small businesses when they literally rely on a certain amount of employees to get jobs done. But at the end of the day, we are all right. We're human beings. And if we're not right mentally, if we're not right physically, or even for most spiritually, we it all crumbles. We all fall apart, right?
Mhm.
So these are conversations that need to be had. And I think that we can better come up with policy changes in the future that could be advocated for, that could work for both parties, not only the mothers that are going through these gaps, and just like you said, it's brutal. At 6 weeks, you're not even yourself, you're not getting sleep, your
Right.
hormones are up and down. I've
Right.
had postpartum depression myself, and with my third, I had more of the baby blues, which
Mhm.
it differs between the longevity. But
Mhm.
man, that is rough. It's
For sure.
rough. And then the first year itself also is rough because you're trying to adjust to your role of being a mother, seeing yourself in a, in a new role, because
Mhm.
now you're not just your own person, you're taking care of another human being.
Right.
So you're dealing also with your mental health and trying to do your best and the best you can to raise the child, right? To be able to nourish them, to be able to take care even for yourself, right? Especially those mothers that are breastfeeding.
Mhm.
And that takes a lot of work and it does affect every aspect. So I would agree 100%. Molly, I don't know if you want to add anything to that as well. If you do,
Sure.
feel free. Hmm.
Yeah. Well, I was thinking, even when you talk about policy changes, I was thinking even just procedural issues within local offices often create gaps for pregnant women. I can think of many situations where, an OBGYN office has a policy of, if you miss an appointment or you cancel with less than 24-hour notice and you do that 3 times, you will get discharged from the practice. And that creates a huge barrier for pregnant women. And yet we see that all the time in my role anyway. And what's really unfortunate is we've had situations where our community health workers are the ones supporting clients in securing transportation via their Medicaid plan. And yet, truth is,
Hmm.
sometimes the transportation that is offered with those plans is not reliable. And so we've had it on more than one occasion advocated with an office like, yes, she missed those because her Medicaid ride did not show up
Hmm.
and she was still discharged from the practice. Um, I can think of another situation where, it was a high risk pregnancy, and the office that was best suited to address her needs discharged the client for
Wow.
the no show issues. And again, and it it just creates such huge gaps in service and continued barriers. So,
I would
I think.
100% agree. And I think as well, this makes me think of where's the humanity as well. But the thing
Mhm,
is that these folks, because I've seen it all, I see it from both ends, but these folks are more focused on this is hitting my business and I could have gave that spot to someone else. That's how
mhm,
they see it in a business aspect. But we
mhm,
also have to have humanity and empathy and look at outside factors that can contribute to things like that happening in terms of folks missing appointments, just like you said, right? Because transportation is not reliable and it's out of their control. So at one end, it's like, and this varies because this is not everywhere. Where I lived in South Florida, there were offices that would actually provide transportation for their own clients, for their own
nice.
patients. But you don't see that everywhere. Not
Mhm,
every office has the capacity and the ability to do that. So yeah, I think the healthcare system overall, when we're talking about these things, just like you said, Molly, like we really have to restructure. And I think instead of thinking as or I mean this in practice, right? For those that are in practice, looking at folks as just another payment, right, from the insurance carriers. We need to be more human and have a little bit more empathy as well and just put ourselves in their shoes, right? Because those are things that I think we can all learn from even more and apply in our daily lives. So now we're going here, and Molly, I'll let you take over here so
okay,
you can present.
sure. And so again, I supervise Strong Beginnings, which is a home visiting program in the Grand Rapids, Michigan area. And before I talk specifically about my program, I want to backtrack just slightly, if that's okay, to talk about some history around systems. I know, Madeline, you had asked earlier, what what's the cause behind some of these disparities systemically? And I'm not sure if everyone here is aware of an individual by the name of J. Marion Sims. And if you're not, I will tell you that he has gotten the title Father of Gynecology. And the way that he got this title, though, was that he experimented on the bodies of enslaved Black women. And so he did lots of things in terms of, procedures, cutting women open, not giving them anesthesia. As a result of this, there were some tools that were created in the gynecological world. However, it was done literally on the bodies of enslaved Black women. The three women that are referenced the most are Anarcha, who was approximately 17, Lucy, who was approximately 18, and then Betsy. And while those three are the women who are named most notably, it's stated to be there were probably 10 to 12 additional women as well who are not named. And so I know there is an effort, instead of, referring to Marion Sims as the father of gynecology, really switching the narrative and calling these women the mothers of gynecology because of their contributions. And with their contributions as enslaved women, you don't have the option to fight or, speak up when your owner has essentially loaned or given you to someone to experiment on. And so, because these women didn't essentially react like one probably would when you're being cut open and things, because they were powerless, they didn't react. And so, that has contributed to a long-standing myth within the medical system that Black women tolerate pain more quickly or more easily. And that still, trickles down, maybe consciously, maybe unconsciously, or the idea that, Black women are strong and they can endure more. And that has perpetuated medical systems and, led to some of the disparities that we are talking about here today. And so it's also an example of how medical authority was basically prioritized over body autonomy. And we still see that in the medical system where individuals aren't seen as the experts of their own body. However, switching gears, that's where we come in as a program, Strong Beginnings. And so what we do at Strong Beginnings is we seek to address that. Specifically, our mission is that Strong Beginnings is a community-wide effort to improve maternal, paternal, and child health among Black and Latina families, promoting families by eliminating racial disparities in birth outcomes. And so we do that through a couple of differing ways in the world of Strong Beginnings. We do one way we do it is we provide education to medical systems. So we give trainings where we talk to medical providers and groups about, some of those biases. And, we encourage pictures of women of color being in offices and in terms of artwork. We encourage that even the books that are being used in medical schools, that the bodies include people of color, even so that people get more used to seeing images of people of color. So that is one thing that we do in Strong Beginnings. We also have some community-related components that I will talk about more specifically. And we also have what I consider the powerhouse of our program is our community health workers. And so our community health workers are as I said, the powerhouse behind our Strong Beginnings program. And so I think the next slide talks a bit more about community health workers. Yes. And so community health workers have shared lived experiences with those that we serve. And we know that when we're seeking medical services, all of us are often intimidated by such services. And when we can have someone who looks like us or we feel like we can relate to them, that lessens the stress around the experience. And so community health workers typically have shared experiences, whether it be from the same geographical area, share the same language, live in the same community, or just have a special knowledge of the people that they serve. And so for us in Strong Beginnings, because we are addressing disparities among Black and Latina mothers and babies, we have community health workers who are Black and Latino women. And what community health workers do is they are home visiting professionals who go and support healthy pregnancies through education, referral assistance, and advocacy, and really try to support and walk alongside women as they are pregnant, giving birth, and then up to 18 months post birth. And so we're able to really have a close relationship with the families that we serve. Quite frankly, as Madeline alluded to earlier about, being left to fend for yourself after having a baby, some of what we do is we just show up. And what I mean by that is we know that sometimes someone showing up makes all the difference to offer support and assistance during vulnerable periods of time. But we can also communicate with doctors' offices. What we try to do is really encourage families that we serve to get comfortable using their voice with the doctor's office. And so we might, go to a home before a medical appointment and say, hey, what are the questions that you have for your medical provider? Shall we write them down? What, do we need to practice asking those questions? What, really walking through with a mother, what does she need to feel comfortable walking into that medical setting? We will also accompany moms if they need us to. We had one situation that makes me smile about a community health worker because of the flexibility of our role being community-based, is that one mom, she was seeking medical care in a place that was far from her home because the drive was easier. It was a straight shot. And she did not want to get her medical care from the place that was very close to her because she didn't know how to park in the ramp. And she just had this fear of getting in the ramp. And so what our community health worker did is she, got to the ramp first, got out of her car, and then waited at the entrance of the ramp to guide the mom in the ramp so that she could be confident going into that ramp so that she could then get medical care that was closer to her home. And so our community health workers really do build trust in lots of creative and tangible ways. And of course, my screen just froze on me. Okay, sorry about that. Um, and so we're really proud of the work that we do as community health workers. We know that families are benefiting from our work. We know that the data tells us that our clients have really good health outcomes compared to other clients who don't have community health workers. And so specific outcomes include things like our clients who have community health workers, 98% of them have health insurance by the time that we close our services. 91% of them 91% of them engage in safe sleep behaviors with their babies. 92% have a postpartum exam. And so I could continue to go on about strong beginnings, but I want to pause for a minute to see if there are any questions from anyone at the moment. Otherwise, I can continue because I am really proud of our community health workers. What I didn't mention about when it comes to their credentials, the beauty of a community health worker model is that it requires simply a high school diploma, because then what happens is we send you to a community health worker course so that you get your community health worker certification. And so that eliminates a barrier for maybe those who don't want to pursue higher education, but really want to, for years anyway, but really want to make a difference. And so we train them through that certification process, and then they have very intensive ongoing monthly trainings just to stay up to date with practices and procedures and resources. And so our community health workers, many of them are certified lactation consultants. So when they're serving a mom and, she's home and she's nursing, and all of a sudden, if something is not going well, you can often call for breastfeeding support at the hospital or local health department. But often the answer you get is, okay, we can, come in and see us in, X number of days or next week. And those of us who have breastfed children know that that's too long when you're experiencing a problem with that. And so our community health workers can go, out immediately or the next day and provide support in that area. Our community health workers do really encourage breastfeeding. And in fact, in our program, 85% of the moms that we serve initiate breastfeeding with their babies, and 73% are still breastfeeding when their babies are 6 months old. And so we really are, again, I use the word proud a lot of that statistic, because we are working to shift the narrative around Black women when it comes to breastfeeding. And so some of you may not know, breastfeeding historically has been a source of pain, emotional pain and distress within the Black community. Because if we go back to enslaved women were often used as wet nurses for the slave masters' babies. And so that was not seen as, something joyful and positive to do with your own baby, than because it was of the historical ramifications. And so we work hard to change that narrative and, recognize this is a gift for your baby. And I can't tell you the number of families we've served where the moms they're the first generation to nurse their babies in their families. And so that is something that we really, really want to walk very closely beside mothers with that. And we also support reproductive life planning as well, because we know that just having, a choice in your plan for reproduction is a part of your healthcare. And so really just providing education so that mothers can make informed decisions about how they want to build their family and the timing of when they build their family. We do know that women's bodies do better when there is 2 years between pregnancies. So we provide education around that. But then ultimately provide family with their choice and their voice in their decision. We also, in the Strong Beginnings program in our community, we do have a few community supports that are open to any Black or brown woman, not just one who is enrolled in the Strong Beginnings program. And so we have a breastfeeding support program that any Black or brown woman can enroll in and get a certified lactation consultant be available for them. We also provide breastfeeding support groups that are culturally appropriate and congruent with the individuals that we serve. And so yeah, we do a lot of things in the Strong Beginnings program that we're really quite proud of. So much so that on the opposite side of the state of Michigan, they're actually beginning to replicate our program. And so we are really excited to see that other agencies recognize the value of community health workers and having support that is relatable to the persons who need medical care. Pregnancy, postpartum time is a very vulnerable time. And so being able just to have someone that you can look at and naturally just feel a little bit more at ease because you feel seen in a way that sometimes you just don't feel seen otherwise. I meet with medical residents pretty regularly and to talk about our program, and I always leave them with this piece of information. I tell them if they could do one thing with the clients they serve, it's simply to pause and actually listen, because we can have a meaningful connection even when somebody at the grocery store. Think of how many times, at least in my generation, you go to the grocery store and you have a brief little exchange with the cashier and you walk away, with a smile, feeling like, oh, yeah, we had a nice little connection. If we can support and ingrain that in medical residents, that, having that type of connection does not take a long time, then I do believe that we can address the systemic disparities on an individual level so that we can improve maternal health outcomes. And so I said a whole lot. And so I'm going to pass it over unless anyone has any questions or follow up to that.
Yes, and for anyone that does have questions, please feel free. If you don't feel comfortable speaking, just feel free to put it in the chat and we'll answer questions that way as well. Um, so at this moment, I want to also touch on the maternal health, mental health aspect of prenatal and postnatal care. And we're going to spend a few minutes, right, talking about something that doesn't often get enough attention, and that is maternal mental health. And what we mean by maternal mental health, it's prenatal anxiety. That's one that doesn't get talked about. We talk about postpartum depression, even postpartum anxiety, but something that doesn't get touched as much is the perinatal anxiety, and that's anxiety that is caused during the pregnancy. And I could tell you this myself from lived experience. I've gone through both perinatal anxiety and perinatal depression, as well as postpartum anxiety and postpartum depression. So, kind of crazy because with my second child, with my first and second, I experienced the postpartum anxiety, postpartum depression. The third, I experienced it the opposite. I got perinatal anxiety and perinatal depression. And I got the baby blues for a couple of weeks, but then I thankfully was able, with medical support, professional help, get through that. But I do notice in our cultures, and I'm talking about women of color, we don't talk about these topics enough. So, this comes within not only cultural stigma as well, but um, I I would say even biases that our cultures have towards mental health in the system itself. Me personally, I've been taught whatever stays in the home, stay like whatever happens in the home stays in the home. And then when it came to topics with dealing with depression, anxiety, I was told pray it away. I came from a religious family, right? I was told that these are, these are normal, but more to sweep it under the rug and having to assume my role as a caretaker. But where was also the concern of me taking care of my mental health, right? Of the way I'm feeling and my emotions. Because if I don't take care of myself, how can I take care of my children? And then in that case, you see various women struggling with their mental health and struggling to raise their children. And they're battling a battle within themselves. And this doesn't get talked about as much. And I even tell myself, oh my God, if I would have had these conversations, even with family members, I wouldn't have felt as crazy, right? Because when we don't talk about these things and they start happening and we feel these symptoms physically, we think that we're going crazy. I'll give you an example. And I love to talk, not just about what I hear from others, but from my own lived experience as well. When I had my daughter, she's now 12. When I had her, a few weeks within the first week, I do not know what got into me. I felt like I wanted to jump in front of a car and have a car run over me. And I felt so ashamed that I felt that way that I didn't tell anyone. But I was feeling desperate. I was feeling crazy. I was having anxiety with overprotecting my child. I couldn't sleep. I was overwatching my child. I was waking up when I did sleep in panic mode, just scared that something would happen to my child. And then I was dealing not only with my hormones, hormonally, but then I was dealing with me feeling inadequate, me feeling, am I doing enough or am I doing the most? Right. There was a lot. And then not only that, I went through a C-section and healing from that in itself, right? For some people, for example, my second, during my C-section, I had a bad reaction to Ancef, which is an antibiotic that's used while you're giving birth. Well, I broke out in hives everywhere. And imagine you being open and you start breaking out in hives and you're being open and there's a procedure being done on you. And when you have a C-section, you can't feel from the waist down. So you're internally panicking as well. So those things, and that in itself, from my second to my third, because I have gaps. I have a 12, a 7, and a 2-year old. But even then, those are things, right, that when you don't process, you start feeling like, oh my God, how about if this happens? How about if that happens again? And even having children, how about if, thankfully I knew what to do by my third, that when I started having the symptoms, I immediately got help and started going on my antidepressants, right? But that's because me going from all of these experiences, I learned how to advocate for myself. And in most cases in our communities, that's what we learn how to do, how to advocate. And in most cases, it works. In some cases, unfortunately, we get undermined. We do not, we're not heard enough and we get pushed to the side. Like if we're, like Molly was saying, historically, right? There is a persona of the Black women being strong enough to handle pain because of historically we've seen of experimentation that has occurred in the Black community to women, right? So there's this conditioning, I like to say, of from generation to generation of not only the Black women feeling like she needs to hold the whole world on the back of her shoulders, but of other cultures perceiving the Black woman as woman that can handle it all, that is strong, right? But then there's some um, microaggressions that come with that as well, right? That don't, we're talking about them more now, but they do, right? There are microaggressions that are forced and put on us by other communities. So what I want to touch on more is that at the end of the day, right, being a new mother, there's so many experiences that you can go through and that we go through, right? Whether it's postpartum depression, postpartum anxiety, or even while you're pregnant, perinatal anxiety or perinatal depression. Those are things, and I tell folks, I know there's taboos too on medication and, while you're pregnant and getting help. But what I tell folks is at the end of the day, don't listen to what I tell you, what other folks tell you. Do your own research, get professional opinions, and do what is going to work for you. Don't do things out of an obligation of, I have to be strong and I have to carry everything on my shoulders because that's what I was taught to do. We have to, at one point, feel feel free enough and be vulnerable to let our guard down and not always feel like we have to have control of everything in terms of, look, I know that we all have to advocate for ourselves, but when we need to get the help, we have to further advocate to get the help and find the resources. And one thing that I tell folks, I know women that will not go to a doctor. They will do their research in finding a culturally competent doctor, right? And they will just not go to any doctor. And this could be a mental health, this can be with your primary care or OBGYN. And I respect them for that because of their lived experiences and them being pushed to the side and not being taken care of in the past, um, and a lack of care per se. They have had to advocate for themselves. And a part of advocating is also doing the research. Because at the end of the day, there's this saying, if you don't save yourself, no one else will. And it's true. And it shows strength when you're able to know, hey, I don't have it all together. I don't need to have it all together, but I'm in a place where I do need help and I do need assistance. And I know that right now I'm not able to carry the whole world on my shoulders. And that's okay. It's okay not to be okay. I like to say that, but it's not okay to stay in a place where you know you're not okay and not seek for resources. And there's various resources. Um, that are available, for perinatal anxiety, perinatal depression, as I stated, and even birth trauma, because there's women, especially women of color, that go through frightening deliveries and C-sections, right? And that's a trauma. And that doesn't get processed. And there's women that I personally know that are scared to go through a pregnancy because of having that birth trauma or not getting the medical help they needed while they were getting birth because professionals waited too late, right? Or their pain was under value as and it wasn't taken seriously enough, right? So we need to think about the experiences that we have gone through ourselves and other women in our community and how those events have been processed, and also being able to process that as a trauma because that in itself can cause PTSD as well. So unfortunately, we do see that many families do um, face additional barriers because of cultural stigma as well. And we do see that a lot. So in many communities, mental health is still viewed as something that should remain private. Like I said before, what happens here stays here. And mothers could hear messages as well as, like I said, just pray about it. Be grateful that your baby's healthy. That's another one, right? Or strong women don't ask for help, right? Or you shouldn't have to ask anyone for help. I've gone through it, you'll get through it, right? And no, we shouldn't have to feel bad or feel like we're underheard or feel less than or weakened because we feel the symptoms that we feel. So, for Black and Latina women and immigrant women and underserved communities, these challenges as a whole are often compounded by difficulty, as we stated, in finding providers who understand their culture, their language, their lived experiences, as well as their unique family dynamics, right? And this is where resource navigation as well comes in. So, and this is just a quick example. Just imagine a new mother that begins experiencing symptoms of postpartum depression shortly after she has given birth. She could feel overwhelmed every day. She could cry frequently as well. She could struggle to bond with her child, with her baby. And from her beliefs, she could believe that asking for help would make her a bad mother. And we see that in our cultures, right? But eventually, her getting right the assistance through a caseworker or a community health advocate, right? Through any local agency or organization, as we see Molly's agency does as well, that she represents, they help, right, in giving her those resources, listening to her story, giving her that white glove care service, right? And just showing that empathy that she's not alone. They understand the struggles because they can relate on a cultural level as well. And just explaining what they can expect during the therapy process, connecting the mother to a postpartum support group. So, and following up, right, that they're receiving that care. So, those warm referrals can make a difference over time. And, we can see, and we've seen it as well, even in our organization, because we deal with a variety of women that come with a variety of different mental health concerns, right? That learning healthy coping mechanisms and starting to feel more connected to themselves, the mother themselves, and their babies, you see their mental health improve. You see the family become more stable, and the woman's confidence grows, and she doesn't fall through the cracks. So, even in that little, right, that little segment where resource navigation can make a world of a difference. So I just want to touch on our model here on Daughters of Both Sons. We deal with the client with resource navigation. We believe in warm handoffs, providing that provider connection. We personally vet all of the therapists that come in, and we follow up with the support. So we're not leaving you alone. We're making sure that you're finding the resources, and we're there with you every step of the way. And you get an assigned caseworker to work with you. And that's within mental health referrals. And even here, we've gotten to the point where we've been aligning clients with primary care physicians and psychiatrists, right, in the field that are culturally competent as well. And we like to advocate and support. And also, we believe, like I stated earlier, in culturally responsive care and provider matching. That is highly important in what we do here. And obviously, partnering with other community agencies across the US that can give that community based care coordination. And at the end of it all, our mission is to help women and families access the care, support, and resources that they deserve as well. So at the end of the day, right, we want to wrap this up in terms of building better systems overall, and just looking at maternal health equity, right, between the system itself, resource navigation, culturally responsive provider matching, advocacy and support, and advocating for our clients, which I know Molly's agency does as well, and giving those referrals, whether it's in the mental health sector or with culturally responsive providers, right, that are trained in culturally responsive care. And that could be with a OBGYN, that could be with your primary care, with a psychiatrist, with a therapist. All of this intercorrelates, and systems that are built like this, at the end of the day, um, one thing that I can say is we try our best as organizations to do the best that we can. But for us to get the word out there and continue to help folks, we have to partner with one another, because where one lacks, the other one can pick up and continue to help give those resources. So, no single organization at the end of the day can solve a maternal health disparity by themselves. We need to work in our communities together to help rebuild these systems, excuse me, and be able to bridge those gaps as well. So just, imagine the ideal maternal support ecosystem. And these are discussion questions that you can think of um, by yourselves, and we can have these discussions too between me, Molly, and Madeline on, think about this. What is working well in your community right now? What barriers are you seeing that still remain? Where do you feel that families fall through the cracks? That could be yourself, or if you're a care coordinator, if you work in the field, whether it's mental health, whether it's in the healthcare field with maternal care, where are you seeing families fall through the cracks? And if you work for any agency or organization, or if you've been um, blessed to be introduced to an agency or organization that has helped you, where do you see that partnerships have been most effective when we make referrals out, right? Because that does help make a world of a difference. And what should happen next for us to break these disparities, to help in bridging the gaps in maternal health care? So you guys can feel free to share examples, but me, Molly, and Madeline will be having these discussions as well, because I want to hear their opinions as we've had this workshop and this discussion on where you guys think within any one of these questions that we can better ourselves, right, as a society to support these ecosystems.
For me personally, I think I've seen, just as a previous care coordinator and just even me myself as a mother, I think that childcare is a big barrier that we need to try to work on. Like, a lot of the doctor's offices don't allow children in the exam room, and for me, like even myself, I've had to, if I don't have childcare, then I just don't go to that appointment because I need someone to watch my baby and he can't be with me. So I think that, I know not every doctor's office is, it's not a daycare. Like, they don't have someone that can watch your child. But I think that if more hospitals had, you know, daycare capabilities, like I know that I'm located in Washington State, and my husband is in the Army, and so that medical center, they have a daycare in it, but your child has to be a certain age to go to the daycare, um, which is a little bit rough. So I think if we had a more inclusive daycare setup in hospitals, or even a daycare setup at all, because I know a lot of hospitals don't, I think that would help um, a lot of those mothers who are falling through the cracks because they don't have childcare.
That's a good point. I agree with that. I think especially in these bigger systems that have the capability to do so, and in these medical shared building spaces that are connected to hospitals, if even for an hour or two, right? If there were workers just like daycares that would be able to help support mothers get childcare just while they attend their appointments, that could make a difference. Because even if you did bring your child, right, it's hard to concentrate on your health while you're attending a child, especially a baby, a toddler, if they're running around. As they get older, yeah, it could be more simple because now, they have tablets and everything and they get distracted. But even then, you're still eyeing your kids, right? So that's a great point to make on where families could fall through the cracks as well. And I mean, for me, I would say, in the point that I would add is partnerships, I think, are extremely effective just managing and running a nonprofit, because wherever we fall short, we have another agency, organization, or provider that can come in and pick up that slack, and vice versa. We've had partners where wherever they're not able to support, we're contracted so we can pick up the slack. So I think partnerships are highly effective, because until, in the ideal world that we wish we could live in, we wish, right, that these ecosystems, excuse me, would be perfected to the point when we have all of these resources, but unfortunately, they're not. So, if we could continue relying on one another to help each other, when one lacks, the other one picks up the slack, and we could continue to support one another, I think that continues to make at least somewhat of a difference, and we can lead by example to other bigger organizations, hospitals, and agencies on where they could continue to fill in the gaps, but we have to continue to advocate. And I think policy work is essential to that as well. I don't know if Molly, if you would like to add anything to that as well.
I I hadn't actually thought about what Madeline just said about daycare and medical offices, and that sounds like such a solvable problem. And so I just want to echo that. I feel like, yes, we are talking about systems and biases and big historical things, and yet, you know, these things are solvable. Some of it is very easily solvable. And so I just think we have to connect with those who are creative and open to those kind of things. When you talk about partnership, Jessica, I think it boils down to relationship, and similarly to partnership, but like partnership tends to build upon those relationships. And so if we can start making those connections with other entities, then, then we can be comfortable, doing warm handoffs when we need to connect those that we're serving to additional services. And we know that, even when we think about the medical care of our Black and Brown pregnant women, it's relationships. If you have a relationship with a medical provider that you feel does hear you and you can be open with, how much more effective is your medical care going to be, and how much more and how much less stress you're going to have during your pregnancy, because we know stress alone produces cortisol. And when we have babies who are being bathed in cortisol in utero, that leads to lower birth weight for those babies. And we know when we look at Black babies, the infant death rate is twice as high as their counterparts. And we know that low birth weight is the number one cause of infant death. And so that's what I have to add at the moment.
Great takeaways, and I 100% agree with everything that you said. And trust me, I'm just at a point where future wise, with various things when it comes to culturally aligned care and how we can expand systems, I think policy work is essential, especially us in the social work field. I think that's where the true change is going to happen, and we're going to see future results if we keep advocating and pushing for that. So, the key takeaways that we want to take away here today are that maternal health disparities are real and they're largely preventable. Con- continue, con- sorry, continuing care. And sorry, guys, my allergies are starting to get to me. Improves outcomes for mothers and infants as well. Community health workers, that's a big one, especially with everything that Molly's doing as well, and what her agency, what they're doing as well. I find that to be very helpful and effective, and also seeing that evidence-based support, right? And seeing helping these patients break those gaps as much as possible, because there's only so much that we can do as advocates, right? To help bring the patients to the care that they need, but we also rely on other third party resources, right, to help us fill those gaps. So just holding each other accountable, even through other agencies and resources, I think that is extremely essential as well. Culturally responsive and trauma informed care, as we stated throughout this whole presentation, it is extremely important. It matters, especially based on worldviews and what you know, we all have different world views, and that in itself, when we have a provider, right, that understands where we're coming from, because even them being a provider, they have experienced this in their own life, right, from their own worldview. So the care and the understanding tends to be different, and then that improves outcomes also in care. And as we were just saying, Molly was saying also, collaboration is essential to advance in maternal health equity. I am a true, believer in partnerships, and as Molly was saying, relationships, having those relationships to be able to give those warm transfers and trusting that those agencies and organizations are going to do their part. It's essential as well, because we know we're handing off the client or patient, right, to the most or best possible option out there for the most part. So resources and next steps, right? Um, you know, you guys will receive, the ones that have joined, maternal health resources, strong beginnings information, also on what Molly and her team are doing. And these are, guys, these are initiatives too that I think folks can advocate in their communities at the local level as well. You don't have to be from Grand Rapids, right, to obviously also believe that community healthcare workers, right, should be in all communities locally at the local level. So I think this is something at the local level that we can push and advocate for in our communities. And then also, we will send you information on Daughters of Both Sons and resource navigation that we have here, referral opportunities as well, partnership opportunities with either one of our organizations. And this webinar is recorded and was recorded. So this will be on YouTube, and you can find it in our Daughters of Both Sons YouTube as well. And the next steps as well would be continuing to build partnerships that strengthen and support mothers and families overall at the end of the day. So in closing, we do know that together we can build systems where every mother is seen, heard, supported, and empowered from pregnancy to possibility, as we spoke today. So we thank you all for joining us. Also, I want to thank Molly from Strong Beginnings for being here with us and having this important conversation, as well as Madeline. Thank you for putting this presentation as well together. If you have any questions as well, you can always email us at hello@daughters of both sons, that's suns.org. You can also look up Molly's agency that she works for as well, Strong Beginnings. And if you guys think that at the local level, you guys can bring this information and give evidence-based cases just as Strong Beginnings is doing, because they have, right, those cases that this program is working in their local community. I think that we could push this in our local communities as well. So I want to thank all of you for showing up today, and showing up most importantly for yourselves. And I hope that you guys have a great rest of your evening. And I thank you all for being here. Thank you, everyone.